I want to read you guys a really nice message that I just received on Instagram. Dr. Yu, great to come across you on social media. You were the ER doctor at the hospital a few years ago when I thought I was having a heart attack. I was driving down by when it happened and thought to myself, this is the best place to have one if there was ever a time, right by the hospital. Turns out it was just a panic attack. You were kind and deeply concerned about my health, how a seemingly young, fit male was having this episode. I made many improvements in my life since that day, mainly reducing stress and work hours, and haven't had one since then. You sitting down and asking me those questions really hit me. Thanks again for everything. These kinds of messages are so impactful and they mean so much to a healthcare worker. And I think they mean a lot more than most people think. There are so many days when I go to work where I feel like I'm not making a real difference, where I just feel like I'm bailing water out of a sinking boat. To give you an example, the other night I was treating a patient who had a life-threatening opioid overdose, and I had a really deep heart-to-heart with this person, was trying to connect them with care. They had agreed to actually go to a clinic to get into a detox center, and I discharged the patient back into the community, and literally 2 hours later, the patient came right back with another opioid overdose. You know, maybe it is a little bit naive of me to think that I can make a real difference or impact in someone's life based on a short encounter in the ER. But when things like this happen, it really does hurt. Like it feels like I'm not moving the needle in any way. But when I do get a nice message or an email or a thank you card from a patient saying that I did make a difference in their life, that is a huge morale boost to me. It makes me want to keep fighting the good fight. And I appreciate this much more than, food or gift cards delivered to the ER. So if you have had a positive experience with a nurse or a doctor or any other healthcare professional, I would encourage you, go that extra mile and write them a brief note. It doesn't have to be any kind of monetary gift or anything like that, but I think it just makes a huge difference. And it's one of the best ways to combat burnout in a crumbling medical system, and it's completely free.